everyone. Welcome back to the Population Health Collaborative Conference. I'm Suzanne Lawson with Constellation Consulting, and we are the convener for the PHC. As a reminder, this meeting is being recorded. Attendees' cameras and microphones are activated today. However, we do ask that you keep your microphones muted. Following today's session, we will have time for Q&A. You may ask your questions live or post your questions in the chat window. And you can join the discussions online through our discussion forum at nmhealthequity.org/PHC. Our final presentation today is from Dana Bloomquist of CWA Strategic and Lynnzy McIntosh of Workshop Wizard. Dana Bloomquist is Senior Account Executive at CWA Strategic Planning, the Path to Health New Mexico Marketing Lead, and a contractor to the New Mexico Department of Health. Dana joined CWA Strategic Communications in August of 2001. Her responsibilities have included working with the Early Childhood Education and Care Department's Family Infant Toddler Program, the New Mexico Department of Health's Breast and Cervical Cancer Early Detection, Comprehensive Care, and Diabetes Prevention and Control Programs, and the Child, Youth, and Families Department. Lynnzy McIntosh has worked with integrating community-based programming in healthcare since 2008 when she joined the staff for the Consortium of Older Adult Wellness in Colorado, eventually serving as Executive Director. Workshop Wizard was created in 2009 to meet the needs of developing referral systems with an entire spectrum of community-based programs, including falls prevention, chronic disease self-management, and diabetes prevention. As Vice President of PAC Software, Inc., she serves as a contractor to the New Mexico Department of Health Diabetes Prevention and Control Program and brings her experience in healthcare referrals, implementation, and data management to programs across the country, including 16 states now using Workshop Wizard. Please welcome Dana Bloomquist and Lynnzy McIntosh.
Well, hi, everybody, and it is very nice to be here. And I know Dana and I have been looking forward to this. So we want to start the conversation about what's going on with the Path to Health New Mexico initiative and how you all can connect to the work we're doing and how you can send your referrals over so that we can help your patients, your clients, your staff, and your families have a healthier life moving forward. So what we want to do is just give you an idea of what we want to do today. A, start the conversation. B, talk about how to make referrals. C, talk about how to connect using the existing referral systems in place and some new things that are coming. And then finally, to talk about the data that's available to partnering providers and healthcare organizations. So we're going to spend some time talking about the website, the public face of the Path to Health initiative, and we're going to talk about all of the behind the scenes work that's involved and all of the curriculums that are included in what we do. There really are 4 parts to the Path to Health initiative. First part was to build it, and that's a part that Dana's going to spend some time on in terms of how this came to be and why we are doing it. The intention is always to be an inclusive place, a place where all of the community-based, evidence-based opportunities were located in one place, a one-stop shop, if you will. And through that work, there have been a number of collaborative connections that have happened, a number of referrals that are available and are available now and live. And also we've added distance learning options. COVID gave us the opportunity to sort of break down walls, if you will. And so a number of the providers that offer the community-based programs we've been working with have had the opportunity to reinvent how they've been working with the people in their communities and have been able to offer distance learning classes that are either over Zoom or even offered by phone. And so what we have discovered is there are a number of people who really like these distance learning options. So I think this is going to be something we're going to be seeing as an ongoing part of all of the Path to Health initiative programs moving forward. So I'm going to turn it over to Dana now, and she is going to walk you through the website and some marketing pieces.
Lynnzy, could you go ahead and continue with the PowerPoint until I open the website itself? That would be great. Thank you. Awesome. Okay. Hey, everyone. Thank you so much for having us today. We're really excited about Paths to Health New Mexico and gratified the program is growing as more folks learn about the helpful programs available to them. First, I want to give you a little bit of a background. We actually started the branding process and development of Paths to Health in 2015, when staff from the Diabetes Prevention and Control Program had a vision to gather multiple evidence-based programs for individuals with chronic health conditions under a single umbrella and share them with New Mexicans statewide. Finding help through one source would make it easier for these individuals. So in 2015, CWA Strategic Communications and Ana Consuelo Matier and Associates began working with the diabetes program on a social marketing process that would involve stakeholders as well as members of the intended audiences to create a brand and this overarching umbrella. Using a process that included branding workshops, focus groups, and surveys over a 2-year period, we developed a brand to encompass this overarching collection of programs in New Mexico. We launched our website in August of 2018, and the website speaks to multiple audiences. First, it offers detailed information about all of the programs available around the state. 2, it offers a way for healthcare professionals to refer their patients. 3, it offers a way for individuals to learn about class opportunities so they can refer themselves. And 4, it offers a place for instructors to download materials that they would need for their classes. So I'm going to share the website now. Okay, can everyone see the website? Great. All right. So I'm just going to run through, give you a brief tour. We have very easy navigation here along the top. These are most of the places that folks will need to go are one of these 4 buttons here at the top. You can get to things in multiple ways. Here are the same basic navigation down at the bottom as up at the top. We have phone numbers for self-referral right here, and you can email us here. So the programs drop down, I'm just going to go left to right. Programs drop down. This is going to show you all of the programs that are available through Paths to Health. So on the drop down, you can either click on a specific program. As you hover over each program name, when you click, it will go to a program. So for example, chronic disease self-management program, we've gone straight there. The other way to get to them is to click on the word programs in the navigation bar, and then we're going to go to the main overall page that describes, gives a little bit more description overview of each of the programs, just brief. And then you can, again, click on each program. So we'll go back to the chronic disease self-management program. And this is the kinds of detail that you're going to get. The format, the program, excuse me, the workshop, the formats available, settings, the kinds of participants, and the skills that will be learned. And then each page has a place to go to the Find a Class page where they can learn about classes that are actually available. And I'll get to that in just a moment. So then the healthcare professionals tab takes you to a place that describes the value of the evidence-based programs that are available through Paths to Health. A little more information here. And then this button here takes you to a page where you download a referral form, and then it has to be faxed. Currently, we're not set up in a way to have a direct referral made through the website. We're not HIPAA compliant, so this is the method you use here. And Lynnzy will talk about other ways later in the presentation. And up here, refer a patient, this goes to the same place. Then on the resources page, you'll find information such as tips for caregivers, infographics about diabetes in the US, both English and Spanish, a place where you can go to take a pre-diabetes risk test. This is also available on the home page. Let me just show you that in this. We have a slider here that goes to doihaveprediabetes.org. And this actually will take you to a CDC, I think it's the CDC website, might be Diabetes Association. That's, well, let me just go there. And this, once you, okay, so this is a CDC website. Once you go here and take the test, it will take you to a page on the CDC website that shows you where you can take a National Diabetes Prevention Program workshop or class. So, so that is available again on the resources page. We have just lots of information that can be downloaded for individuals and for healthcare professionals. So lots of great information there. On the training page, so there's overview information about what kinds of training folks can take to become either a lifestyle coach for the national DPP or a workshop leader for one of the chronic disease self-management education programs. So there's some detail here, and so anyone who is interested in becoming a workshop leader of sorts can go there. On the success stories page, we have these great success stories that were written to really give more detail about how the programs are helping individuals in our communities. For example, this one talks about the important role of community health workers. So this is a great story. If you have time, go back and look at our website and read some of these stories. They're well written, interesting, and they really show the value of the programs. And obviously there are more, and here's one on that's in Spanish. So this is a great one as well. And then our partners page lists all the various partners that we're working with and includes links to their websites. To go to the navigation up here, here's the news and updates page, just what you would think. It's updates on programs. We have a link to the response to COVID-19, for example, goes to the DOH website that does that. Here's a place where you can assess your risk of falls with these different, with these links. More information about the diabetes self-management education and support programs, Spanish language programs, resources for the diabetes prevention program. So there's a lot of good information here, and it's updated on a regular basis. Let's see. I'll go to the instructor login page. Is just as you would expect. You would log in, and this is where you can get logos that you can use to develop materials. You would need to be working specifically with the Paths to Health program, delivering workshops and other programs in order to have a login. But it has flyers and forms and the things that you would need as a workshop leader. So the Find a Class page, this is where kind of the meat of the website is found. And there's a lot of detail in here. So this kind of explains what you would need to do to find a class. So hopefully people will take the time to read. It's not that many steps. But this map shows where in the state these programs are going to be available. So you can, in this left navigation box, format would be distance learning or in person, and then language being English or Spanish. And it sorts things in that way. So our programs are divided, are categorized by preventing diabetes, preventing falls, self-management for chronic conditions, and self-management through healthier eating. So for example, you would click on a course or a class that you're interested in. Then over here on the right, you probably saw the drop, and you would click there, and then it's going to tell you where the program is located, the dates, the times, the contact information, and a little more detail here. So then we'll return to class options and we'll clear everything. We can also display everything. So this shows where programs are being held around the state. And again, these are, let me clear it all again. For example, distance learning, let's go to DSMP. And so this is available here. There are Zoom sites. So this is going to give you the contact information for Catherine Offit, for example, phone numbers with a little bit more detail, dates they're starting, what times, etc. So there's a lot of information here in the Find a Class page. And let's see, what else can we show you here? Click more. So this is going to show you all of the distance learning workshops that are available. So it scrolls quite a ways down there. So I won't go through all of that, but there are a lot of classes available around the state. So, oh, and the last thing I want to show you here is we do have a Facebook page now. And this is where we're sharing information, sometimes about classes, but just different information about things going on in the state. National Cancer Survivors Day with a link to the Find a Class page, because we offer a program called Cancer Thriving and Surviving. So if you haven't liked our page, please go and like us. It's at Paths to Health NM, and there's links to the website and links to the phone numbers, etc. So I'm going to turn this back over to Lynnzy, and we're going to go to the next page in the PowerPoint. So
okay, you're welcome. Let me see if I can get it to move forward. There we go.
Perfect. Okay, just to give you a little information about the website and how it's grown. We're pretty excited. In 2018, we started late in the year, so I have annualized numbers of 1,388. In 2019, we obviously grew. We more than doubled our users. 2020, we continue to grow, and this year, again, annualized, but our numbers are up higher again. So we're pretty excited about the growth of the website and the use, as well as the growth of our Facebook page. We've only had that for a few months, so we haven't seen as much growth yet, but we expect it to explode at a point. We're excited about that. Next slide. And then also, just to let you know the types of materials we have, we've developed wrap cards, as you can see over on the left. It's just a real overview of the programs available through Paths to Health. We have a subscription or a prescription form that can be used in doctors, in healthcare provider offices. We have a number of forms that we've developed to make everything consistent and easy to read. We have workshop flyers that we've developed. We have general information flyers about some of the programs. These workshop flyers, the one shown here, can be updated to, it's basically a template that our workshop leaders can download, and they can put in the name of the facility, when the program's being held, who the contact is, that sort of information. And we have them for the distance learning, and we have them for the in-person classes. And then we've done a little bit of advertising. We advertised in the Albuquerque Journal earlier this year, and we had bus wraps to promote the programs. Just, no specific program, but just paths to health in general, so people would know that there was a resource out there where they can get help with their chronic conditions. And if you're from Albuquerque, you know that the buses run around the city. So those that kind of advertising is seen all around the city, and not just it's not one bus in one specific area, it rotates. And that's all I have on the marketing materials. So back to Lynnzy.
Well, we have thank you, Dana. We have all these amazing partners statewide. I'm not going to try and read them all to you, but just know that we are working with community-based organizations, healthcare organizations, state agencies, small practices, large practices, pharmacies, et cetera, et cetera. So we would welcome any of you who do not see yourself on this list to reach out and become involved with really this initiative that is designed to reach everybody in the state with a chronic condition or at risk of a chronic condition. And we work with the Wellness Referral Center. Adelante has been a great partner, and they provide a lot of the contact of the people that are referred to our programs. So what would happen is we would receive a referral from a healthcare provider. The Wellness Referral Center would, through their call center, contact people and help them get into the right evidence-based curriculum or intervention. And that's usually the way it works. However, sometimes organizations like Durand Pharmacy that's offering the diabetes prevention program, you heard Stephanie talk about how connected they are to their patients. And so in their case, they work directly with their patients on getting them into a program, confirming with them the start of the diabetes prevention program, and then hosting those programs as their patients walk through them. So that's a great process as well. So what all is included in our initiative in Paths to Health New Mexico? Well, as I mentioned, there are a number of evidence-based programs. They include the National Diabetes Prevention Program, which is from the Center for Disease Control. They include the Self-Management Resource Center programs, which were all developed out of Stanford University. They include a number of different falls prevention programs. I'm sure you're familiar with the National Diabetes Prevention Program, which offers a full year of support to people who are working to lose weight, to move more, and to lower their risk of having type 2 diabetes. There's also the Medicare version, which is a reimbursable program that's being offered by several providers throughout the state. And again, that is a reimbursable program. The self-management programs are designed for people who have received a diagnosis of a chronic condition. The basic one is the Chronic Disease Self-Management Program, which has been around about 30 years. But there are also several other ones that are diagnosis specific. There's one for chronic pain management, cancer thriving and surviving, as you heard Dana mention. There's also a diabetes self-management program, one for people who are HIV positive. There are also self-management courses that are not about disease management in the traditional sense, but are about healthy eating and managing your condition through healthy shopping, food prep, eating, like the Kitchen Creations program. And those classes are offered in Spanish as well as English, as well as one that is geared toward African American cuisine. Now, the self-management programs that are out of the Self-Management Resource Center, the chronic disease program, the diabetes program, are also offered in Spanish. And right now, many of them are also offered as distance learning options. So not only a small group that gathers in a classroom, but a small group that gather by phone or a small group that gather via Zoom. There are some other programs that I wanted to also mention. One is the YMCA blood pressure self-monitoring program. And I know Sarah was on the call with us and hopefully still is. The YMCA blood pressure self-monitoring program also includes programs that are nutrition for healthier eating to control blood pressure, and even mindfulness for how to help you, again, control blood pressure. And then one of our newest offerings is called Walk with Ease, which is a self-directed walking program that is either something you do totally on your own or something you can do in small groups that combine some gentle exercise and also setting some really attainable goals to get you moving. We also have a number of falls prevention curriculums. They run the gamut from something like Otago, which is designed to be offered as an intervention that is given by physical therapists or physical therapist assistants in the home for people who are usually those who are homebound, to Matter of Balance, which addresses the fear of falling and also includes some gentle exercises, all the way up through 2 different versions of Tai Chi for better balance and for falls prevention. So how does all this work? How do we get your patients into classes? Well, I work with Workshop Wizard, which is sort of the behind the scenes piece of this. And what we do is when we receive a referral from a healthcare provider, it goes into Workshop Wizard. When we receive a class, when our leaders, instructors set up classes, they put them into Workshop Wizard. Then it is magically sent to the Paths to Health New Mexico website, where it shows on that beautiful website. In the meantime, we are working behind the scenes to track all of the contacts that are made of every single referral that comes into the system. So we're able to track what all curriculums they're interested in, what contacts are made, what a patient says when we make contact. So are they saying, I don't know why anybody referred me. I don't have high blood pressure. There's nothing wrong with me. I don't need any help. Life is good. We'd like to give that feedback back to the referring provider so that they can have another conversation with their patient about maybe getting honest about how a program in their community could help support them in making changes. But we also want the doctors to know that someone is very motivated or someone really wants to attend the class but doesn't have transportation. So we track all of that information. Sometimes it takes us a long time. I'm talking a year to get someone who is referred to a program to actually be able to get started in a program. But we let the providers know as often as they want what the feedback is we're getting from the patient. One of the ways we do that is this kind of simple report that goes back that shows everything that the patient, not only the contacts that have been made, but where they have enrolled. And then we can track things in great detail. If it's the end of the day, that's how you say it. But we can track things for the diabetes prevention program, such as weight on a weekly basis, activity level on a weekly basis, so that we can then send out information back to the referring provider that says, your patient has now lost 5% of their weight. And the target is nationally 5% or more is considered a great success in reduction in body weight and improving general health outcomes. And your patient has now achieved that. So we can send that kind of information back to the referring clinician as requested as well. And again, this is really important, not only for the physician or the practice to understand that the referral they're making is meaningful, valuable, but it's also important so that then the clinician can message the importance of the work the patient is doing so that they can have that conversation, reinforce the changes that are being made, and help the patient stay engaged and motivated. So it is of great import for us to be able to provide back as much data as we can to the clinician. Most of the work we do with Workshop Wizard is de-identified. So we are HIPAA compliant. So when we're working with referrals, when we're working with information coming into the system, when we're working with protected health information, it's all very HIPAA compliant. But we can also do some de-identified reports so that we can let people know overall of all of the workshops that are happening in the state, here's the statewide completion rate. Here's how many people entered the program. Here was their success in the program. And here's the age breakdown, race and ethnicity, marital status, et cetera, et cetera. So we're able to do both kinds of reports out of Workshop Wizard. So next question would be, how do you get patients to us? That's what the big question mark is. And we have a couple of different ways of doing that. We want to work with you however you are using existing referral processes. So if you are used to faxing, as Dana mentioned, there is a fax referral form. There's a dedicated fax line. As you know, that's HIPAA compliant. We can also start working that way with you, with receiving faxes from you, and then set up a secure file transfer protocol so that we are moving toward a more, a higher tech, if you will, referral process. We also have the ability to work with EMRs, and you can also go to the Paths to Health New Mexico website and pull down that fax form. There are also a couple of self-referral numbers, and both of them are here, and they'll be on the page at the end. I think what I want to say about this is that it's important from our perspective that we really talk about referrals rather than just recommendations to the program. In part because a referral just carries more weight. If a provider, if a clinician, if someone at the practice says, this is important to you, what these folks are offering in these classes will really help reinforce the changes we're talking about making to help you feel better. That kind of a message carries more weight, makes it much easier for someone to become involved and engaged in a prevention class or a self-management program. So we really want to lean into working with clinicians on a real live referral, one where they send us a name and contact information and we follow up. So one of the ways that we do that is we can work with great detail with a health system on how to set up workflows for making referrals to us, when the information comes to us, what we do with it, when we send reports back. We can get very detailed on that. If there's already a system in place, we are happy to work with what is already in place. Paths to Health New Mexico is now included in the provider-to-provider section of eClinicalWorks, so the P2P section. And we have not had a chance to test this. If any of you are on the call today, we would look forward to connecting with you and doing some testing on this. We're going to be working with the Primary Care Association later this summer, and hopefully we'll have some good results to be able to share with you. But if you're using P2P right now, let us know, and we would love to work with you on some testing and pilot programs. There's just a copy of the referral form. And I know that what Dana and I are hoping is that you will send us a chat and you will let us know you would like some more information, either about connecting us to the work you're doing, becoming an involved partnering organization, helping us spread the word about what all is included in the Path to Health New Mexico initiative, or just to send us some of your referrals for patients and for clients that you see that need some assistance. So Dana, what else would you like to say?
I meant to mention earlier and forgot to, we've developed some widgets or little graphics that any entity can place on a website that includes coding, so that when someone clicks on that graphic, it will go directly to our website. So if you have a website you'd like that added to, or if you know someone, please let me know, or just give my information to that person so they can contact me and I can get them that coding with the graphic. We have actually 3 options for graphics, different shapes and sizes for depending on the website needs.
Okay. Thanks, Dana. So you are invited. What this means is you are invited to continue the conversation with us. I know it's a whole lot of information to run through in a very short amount of time. I know that a number of you that are on the call with us are already working with Workshop Wizard, either in New Mexico or West Virginia or other places far and near. And I know that many of you are already familiar with the evidence-based programs that we're offering. So please, if you have questions, if you have comments, we have a few minutes and we would really like to continue the conversation at this point.
Thanks so much, Lynnzy and Dana. As Lynnzy mentioned, if you have questions or comments that you'd like to share, please feel free to put them in the chat, or you can also feel free to unmute yourself and we'll facilitate questions from there. One question, okay, so I see your emails. Do you all mind if we post your emails on the PHC website as resources, so that if somebody wants to contact you after the fact, then they can go to the website to get your emails?
Absolutely.
That would be great. And I'll send you the slides too, so you'll have those as well.
Okay, and if there's anything that you all want to post as a quote resource on the PHC website, we can do that as well. We do have a section on the site for that, so we can put the prescription list or whatever else that you want to put on there as resources. Just email them to me and I'll get them uploaded for you.
Great.
Any other questions or comments for Lynnzy or Dana?
Just a comment. Thanks both Dana and Lynnzy. Excellent presentation as always. Really appreciate it. So
thanks, Wayne.
I hope there were a lot of people
Wayne.
here. It kind of looks like our gallery has gotten smaller. I don't know if
it does.
Don't know if people weren't able to come back, but thanks so much.
Well, the really cool people are here.
True.
We are recording this session, so we'll post it too and let people know so they can come back and watch it later if they need to.
Great. Excellent.
Great.
No, you guys always do a very, very good job. I really appreciate it.
Thank you, Wayne.
I just wanted to say this to Samantha, and I think when Lynnzy references West Virginia, it's our group, I'm sure, but ideally, we've been doing this work right along with you all in our state, and we serve as a contractor for the EHR work related to heart disease and stroke in New Mexico. And I just want to say you guys have come a long way. I've been a part of hearing about this work since the inception of Paths to Health. And Dana, I really appreciate your description of the website. I think you did an amazing job with just describing it simply and then what it's there for. And I think you guys have really done a great job around that.
Thank you.
I will say, lots of work is being done around Walk with Ease, and I give props to Harry and Lynnzy for trying to figure out what's required by all of the funders and and I know that there's a lot of work happening. Doreen and I were talking about that on the last work group call is, with the new standards with the diabetes prevention program, it's a real impact on every state and every partner, whether it be a health system or a community-based program. So I will say that's a real asset of working in a collective group is everybody's on top of everything at every level and you don't miss anything. So I'm super excited to hear how the referral processes evolve in New Mexico and how people get more connected to the programs.
Thank you, Samantha.
You guys had a couple of comments that came in. Abby said, thank you for your presentation. She'll be reaching out. Well done. And Sarah said she had to go, but thanks and great presentation.
Thank you.
Okay. So again, thanks so much, Dana and Lynnzy. We really appreciate it. And before
Thank
we
you.
end our day today, if our attendees can please answer one more poll that has just popped up for you, we would appreciate it. It's just a few questions and it's anonymous and it will help us in our continued QI efforts. Thanks again, everyone, for your attendance and participation today. A special thanks go out to our presenters, Dr. Tracy Collins, Dr. Jennifer Gomez-Chavez, Stephanie Hedrick, Dana Bloomquist, and Lynnzy McIntosh.
And to Suzanne Lawson for
Thank
all
you,
the
Wayne.
hard work and putting this together. It really went well. I found it very, very interesting and very helpful.
Oh, thank you so much.
Yeah, thank you for all of your hard work.
You bet. As the Population Health Collaborative continues to move forward, please know that we will be posting information and updates to the collaborative website at nmhealthequity.org/PHC. Additionally, the discussion board is live, so we invite you to use that as a tool and resource for population health discussions for this group, as well as others throughout the state. It's not limited just to PHC members, so please feel free to share the PHC website and the discussion board to whoever may be interested. I think that's all for today. Thanks so much, everyone. Have a great day.
Thank you.
Thank you. Bye, everybody. Good to see you all.
Bye-bye.
You have a good evening.